total knee replacement, uncemented. This surgical procedure removes the damaged and painful areas of the femur and tibia inside the knee joint. These areas are then replaced with specially designed metal and polyethylene plastic parts. The patient is positioned so the knee can be bent comfortably and the area is cleaned and sterilized. An IV with general anesthesia is administered. An incision is made along the side of the patella to allow the surgeon access to the knee joint. The joint is examined. The damaged portions of the femur bone and cartilage are cut away. The end of the femur is reshaped to allow a metal femoral component to fit in place. The metal component is attached to the end of the femur. The implant is made of specialized metal that approximates the structure of bone. This allows the bone to grow into the implant and creates a strong bond without the use of bone cement. The damaged cartilage and bone are cut away from the end of the tibia. The end of the tibia is reshaped to receive the metal tibial component. The metal tibial component is placed into the tibia. The implant is made of the same specialized metal as the femur implant, so no bone cement is required. A polyethylene insert is attached to the metal tibial component. The insert will support the body's weight and will allow the femur to glide over the tibia. The tibia with its new surface and the femur with its new metal component are put together to form a new knee joint. To make sure the patella, or kneecap, glides smoothly over the new artificial knee, its rear surface is prepared to receive a plastic component, which is inserted. The incision is closed with sutures or with surgical staples. A bandage is applied, and patients will receive physical therapy. Many patients may be able to put full weight on the leg within 1 to 2 days after the procedure.